they were right to do it.
We don't have enough tests.
It is roughly double what Republicans originally designed as a stopgap measure. Schumer says the next bill will help cash-starved local and state governments, among others. Sagar Meghani, Washington.
President Trump has announced that he will be placing a 60-day hold on immigration in an effort to limit competition for jobs in a U.S. economy wrecked by the virus.
By pausing immigration, we'll help put unemployed Americans first in line for jobs as America reopens. So important. It would be wrong and unjust for Americans laid off by the virus to be replaced with new immigrant labor flown in from abroad.
Immigration advocates like Robert McCaw with the Council on American Islamic Relations say the order ignores the fact that immigrants are working on the front lines helping the country get through the pandemic.
It's not going to solve the coronavirus pandemic. It's going to lead us to a shortage of healthcare providers, people that are involved in transportation, pharmacy, grocery. It puts us at a disadvantage. It's not going to help us out of the problem Trump's made in mismanaging this pandemic. It's a distraction.
Almost all visa processing by the State Department has already been suspended for weeks because of the coronavirus. Health officials in the state of Arizona Sunday said positive coronavirus tests reached nearly 5,000 with 184 known deaths in the state. And the Navajo Nation, which extends into parts of Arizona, New Mexico, and Utah, has been hit harder than any other Native American tribe. The Navajo Area Indian Health Service said the number of positive coronavirus tests had surpassed 1,100 as of Saturday, with 44 known deaths. Joining us to talk more about why this might be the case for this particular tribe is Sarah Crickett, Professor of Natural Resources and Civil Procedure Indian Law at the University of Colorado. She's also the co-editor of Tribes, Land, and Environment. What do you make of these preliminary statistics?
There has been more widespread and aggressive testing across the Navajo Nation than other places, whether it's Indian country or not. And, the Navajo Nation just has a big population relative to other tribes. If it's proportional, we can only speculate. So here's one possible theory, but it's speculation. One thing that's true about the Navajo Nation is that it's extremely rural. There's a lack of infrastructure, and the lack of infrastructure extends to not having sufficient water resources flowing to many homes built throughout the Navajo Nation, and insufficient stores and places to shop. And so there are two phenomena which are pretty common for Navajo families and households. One is leaving the reservation for wage work. A lot of Navajo tribal members will leave the Navajo Nation to work and then come back home because the extended family is still, a very important unit for Navajo people. And so even if they leave for work during the week or even for weeks at a time, come back home. Of course, that's a way to import diseases, including the coronavirus. And the small town called Chilchimbito, which was one of the first sites of the spread of the virus. It's a tiny community near Kayenta, Arizona. And apparently there was a church service, and a lot of people got sick at the church service, and then it spread out from there. I don't know, but I could surmise that it must have been folks going away to work or jobs outside of the Navajo Nation and coming back home for ceremonies, services, gatherings with family, and therefore spreading the virus. That's one theory about why it might have spread. And then secondly, because of the rural nature of the Navajo Nation and also the lack of infrastructure and services, it's more difficult to engage in all the best practices that we've known about for months now, like wash your hands for 20 seconds. Well, if you don't have running water, and water is scarce and has to serve many functions throughout an extended family homestead, that's just harder to comply with even if people are trying. And then second, stay-at-home orders. The Navajo Nation has been, again, I think very forward-looking. The President, Jonathan Nez, issued stay-at-home orders for the nation and a curfew because, he's trying to use the nation's sovereignty to protect his people. But when people are very used to having to go to town to shop on a regular basis, that probably persisted for longer than it should have while the virus was spreading.
Do you have any idea how they were able to get so much testing done?
Like the Navajo area hospitals, either Indian Health Service hospitals or a network of Indian Health Service facilities throughout the Navajo Nation, was pretty early to engage in more widespread testing than is typically provided in extremely rural areas. I think it's still not sufficient. I mean, IHS funding has been insufficient for a long time, but at least it's there. You know, at least there are these resources for health services available to Native people because of the treaty rights that they have that provide for this provision of public health services. So it was a network of hospitals that didn't exist but for, you know, the unique government-to-government relationship with the tribe.
And what about the actual hospital health services available to those people who are sick with the virus?
It sounds like the facilities are getting fairly quickly tapped out. Some of the clinics are really small clinics and don't have the full range of inpatient services that is necessary to treat COVID-19 patients who get quite sick and need respirators and so forth. Hospitals like the Tuba City Indian Medical Center is bigger and has more facilities and resources, but I think this is the worry, and this is why, again, the nation took such aggressive steps. It wouldn't take much to put their resources over the edge and have a scenario similar to what happened and is happening in New York City. Putting the testing in context will be useful and important, I think, as the story gets out. It may well be true that the Navajo Nation does have more cases than, say, the rest of Arizona, and that would be consistent with, you know, the way that the disease has fallen unequally on different populations, right? Inequality is a pre-existing condition. Certainly would be true in Indian country, but it could also be true that because the nation exercised its sovereignty early to get going on this, they just know more than other rural and low-income populations throughout the West. Definitely are stories that show that the numbers of cases within the Navajo portion of Arizona are lower than in the rest of Arizona. But there, I think it's just a wait and see. It could just be because Navajo Nation was ahead of the game on testing. I think we just don't know yet.
It still fascinates me, though, that we can't get testing, but then the Native Americans who have so little to work with were able to do that and have the foresight to do that.
Yeah. I mean, I feel like, as I've been following the story, I feel like it's telling us two things. One is absolutely revealing the underlying structural inequalities that Native people face in terms of their health, that they're more vulnerable, that because of leave and come home to shop and do wage work situation, they are more vulnerable to getting the disease, and then it's likely once they get sick due to pre-existing conditions because of inequality that they'll get sicker than, you know, wealthier populations. That's all true. At the same time, it's like a forceful show of tribal self-determination that the Navajo Nation was able to really step out ahead of the game and do more testing to find out the extent of the problem.
Sarah Krakoff, Professor of Natural Resources and Civil Procedure Indian Law at the University of Colorado. Nurses in Malawi's public hospitals are staging sit-ins to demand protective gear as well as increased hazard pay due to COVID-19, the disease caused by the coronavirus. The government Monday announced a 200% pay increase and promised to give them personal protective equipment this week. But health workers say the pay increase should be permanent, not tied to the coronavirus. Eric Messina reports from Malawi.
The strike, which started Friday, has crippled the country's health system. Patients in state hospitals have been discharged, except those who are seriously ill. Most would-be patients, including expectant mothers, are being turned away. Nelia Galanda, who is 9 months pregnant, was among many turned away Tuesday from the Central Hospital in the capital, Lilongwe. She spoke to VOA by telephone. Galanda says, I am too poor to go to a private hospital. She says, should the strike continue, I will just go to my village and seek assistance from the traditional birth attendants. Although the government discourages this, healthcare workers say they began the sit-ins because the government has not addressed grievances related to the ongoing COVID-19 crisis. Charles Smith is the president of the National Organization of Nurses and Midwives of Malawi. He says medical staff must have the proper gear to work in hospitals at this time.
You would agree with me that this time we define everybody as suspect up until she is tested the other way. So we said that can we have personal protective equipment to keep ourselves safe, but also safety of the public.
In a memo Monday to health workers, the government announced a risk allowance of about 200% to stop the strike. Smith, however, says the nurses are unhappy with the conditions attached.
Because the conclusion of the circular is indicating that this allowance is only for the time of COVID-19. So we are saying health workers have been exposed to heavy risk, and we've always lived by God's grace. That's what we said many times. So we are saying, why should it be for only, the COVID time?
On Monday, Health Minister Cheaptoyman acknowledged the shortage of the medical supplies, including PPEs, and said efforts are underway to procure more.
Government, together with its partners, are working on adopting some innovations from the academia and local industry to manufacture personal protective equipment. Already, Queen Elizabeth Central Hospital has procured 3,000 face shields from the Cabinet. Other companies are also exploring the possibility of producing other protected garments and equipment.
Government officials and the leaders of the Nurses Association were due to meet late Tuesday in an effort to end the sit-ins. Lamek Masina for VOA News, Blantyre.
A new report warns that more than 250 million people around the world could face acute hunger because of the economic impact of the COVID-19 pandemic. Lisa Schlein reports for VOA from Geneva on the 2020 Global Report on Food Crises produced by the World Food Program, Food and Agriculture Organization, and 14 other agencies.
Prior to the COVID-19 pandemic, the report said 135 million people around the world were suffering from severe hunger. But authors of the report warn the pandemic will more than double that number by the end of the year if swift, vigorous action is not taken. The report cites the main drivers of world hunger as conflict, climate change, and economic crises. It says Africa is the worst affected continent in the world, followed by Asia and Latin America. It adds the majority of people suffering acute food insecurity, some 77%, are in countries of conflict. World Food Program Chief Economist Arif Hussein tells VOA people in countries such as Yemen, the Democratic Republic of Congo, Afghanistan, Syria, and South Sudan run the greatest risks.
If we don't get to them, their lives already hang by a thread. So if we don't get to them, they will pay the ultimate price. Every given day, in normal times, there are about 21,000 people who lose their lives to hunger. Every given day, not COVID, every given day. A child dies every 10 seconds because of malnutrition.
Hussein says quick action must be taken to assist people in those in other countries at risk. He says trade and supply chains must act, and food and other necessary supplies must be pre-positioned. He says aid agencies can and must help governments that have safety nets and protection plans scale up those programs.
We should not forget about the agricultural sector. Imagine, okay, fine, we have good states right now, but if the supply chain stops to work and seeds and fertilizer and other things are not getting to farmers, or farmers cannot go to their fields, what will happen next year? Next year we will actually have a shortage of food. And that is something we must avoid.
UN aid agencies anticipate they will need between $10 and $12 billion this year to tackle the expected food crisis. But they say they need $1.9 billion immediately to make sure enough food is in place to assist people over the next 3 months, especially those who are trapped in war zones. Lisa Schlein for VOA News, Geneva.
Here are some of the other stories we're following at VOA. The World Health Organization said Tuesday that all available evidence suggests that the novel coronavirus originated in animals in China late last year and was not manipulated or produced in a laboratory. U.S. President Donald Trump said last week that his government was trying to determine whether the virus emanated from a lab in the central Chinese city of Wuhan, where the coronavirus pandemic emerged in December. The U.S. Navy Tuesday said that 2 U.S. warships are operating in the South China Sea, with 3 regional security sources saying they were near an area of a standoff between China and Malaysia. The Chinese government research ship was spotted last week conducting a survey close to an exploration vessel operated by Malaysia's state oil company months after it undertook a similar patrol off Vietnam. And allies of both Venezuelan President Nicolas Maduro and his bitter foe, opposition leader Juan Guaido, have secretly begun exploratory talks as concerns grow about the possible impact of the spread of the coronavirus. The discussions emerged from concerns about the respiratory illness, hyperinflation, and growing fuel shortages, as well as worries among some members of the ruling Socialist Party about how to ensure their political survival under a possible change of government, and Washington tightens sanctions. Stay with VOA for all the latest world news.
Make a difference by honoring ordinary people doing extraordinary things to help one another. VOA encourages you to tell us about everyday people who have shown leadership in your communities during the coronavirus crisis. Submit your nominations to VOA Leaders at voanews.com. Send us your name, phone number, and email, and a VOA reporter will contact you. We're all in this together.
Ugandan security forces have arrested a writer and television news anchor over posts they allegedly wrote on social media related to the coronavirus pandemic. Author Kakwenza Rukira Bashaija appeared in court Monday charged with committing an act that could spread the virus. Police also detained TV anchor Samson Kasumba as he left work and say he's under investigation. Halima Adamani reports from Kampala.
Kakwenza Rukira Bashaija was arrested Monday by a team of operatives from the Chieftaincy of Military Intelligence who stormed his home in Iganga district, eastern Uganda. Kakwenza is the author of a satirical book titled The Greedy Barbarian, which most readers see as a comment on the president, Yoweri Museveni. After his arrest, he appeared before a Grade 1 magistrate court in Iganga and was charged with conducting an act likely to spread a disease. He is accused of posting a Facebook message on April 6th that allegedly urged the public not to comply with public health guidelines issued to prevent the spread of COVID-19. In the message, Kakwenza posted a picture taken inside a market showing how people in Iganga were ignoring government guidelines on social distancing. The message suggested the president needs to be serious about enforcing directives and said if the country plunges into the abyss of famine, never blame coronavirus but yourself and bigoted methods. Aaron Kiza, Kakwenza's lawyer, spoke to VOA via WhatsApp.
They produced him in the court, but now not in Kampala, in Uganda, and he was remanded up to 6 May. They refused him the chance to make his bail application yesterday, and he has some torture marks, especially on his feet. But we are happy that he was released from military detention to civil detention.
In a separate incident, police arrested the Kampala television anchor Samson Kasumba as he left his TV station Monday night. Police spokesman Fred Enanga spoke about the arrest on Tuesday.
It is a subject of investigation and it is not connected in any way to his journalistic work, but is being investigated together with others for alleged subversive activities.
The spokesman did not specify what the alleged activities were. Over the weekend, Kasumba posted a Facebook message about the coronavirus that appeared to be non-controversial. The message said recoveries have surpassed active cases in Uganda and asked if Uganda was the first country to accomplish this. Arnold Froger, head of the Africa Desk for Media Advocacy Group Reporters Without Borders, said the group has recorded 65 press freedom violations in sub-Saharan Africa since the start of the coronavirus crisis. He said authorities in multiple countries are trying to make journalists stick to the government line on the pandemic.
Because they are afraid that independent information may get out. They are afraid that their official discourse may not be what corresponds to the facts that journalists are finding independently.
Reporters Without Borders insist correct information is essential in the fight against the pandemic and has called on governments to make the media their ally, not an enemy. Halima Asmani for VA News, Kampala.
Reuters reports that South Korean and Chinese officials and sources familiar with U.S. intelligence Tuesday cast doubt on reports that North Korean leader Kim Jong-un is gravely ill after a cardiovascular procedure. While the White House says it's closely monitoring the matter, U.S. President Donald Trump, who held unprecedented summits with Kim in 2018 and 2019 in an attempt to persuade him to give up his nuclear weapons, said the reports have not been confirmed, and he did not put much credence into them. Western countries are believed to have few, if any, intelligence assets in North Korea, which is one of the most secretive and oppressive countries in the world. North Korea has not commented, but it does bring up the question of what sort of contingency plan the U.S. has if the reclusive leader of a nation known to be actively developing nuclear technology were to die. Joining us for that is Bruce Bennett, Senior International Defense Researcher with the RAND Corporation. Does the U.S. have a contingency plan if something like that were to happen?
There have always been discussions of, so what do we do in that kind of case? The details of which haven't been made public, but my guess is that if something like him passing away happens, you've got basically three alternatives to consider. According to what I've been told by defectors, Kim has his oldest child is a son. It's a son who was not, the mother is not Ri Sol-ju. It's somebody before her. And so the son is presumably about 12 years old, maybe 13, in that kind of age range. Kim knows that if someone else takes over, his son is dead. Maybe not right away, but within a few years, he's gone, just like Jong Sung-taek was gone within a few years.
You mean he'll be murdered?
He'll be eliminated by whoever the person is who does take over, because whoever does take over is not going to want an alternative potential leader.
Who would the potential person be that would be in succession?
Let's start with the son. So the son could be his choice, but the son is so young, he's going to need a regent. And the logical regent, for a lot of reasons, is Kim Yo-jong, because she's unlikely to ever become the leader and displace the son because of culture with regard to women. She may be very reliable in terms of getting him through the time until he's able to start taking over himself.
Should we have some kind of a plan to know what to do in the case that this nuclear power should have its leader die?
We may well have a plan. If suddenly there's a military coup and the military takes over, maybe we haven't planned for that. My sense, again, from talking with defectors who should know, is that the senior leaders are really not happy with the Kim family. Kim Jong-un has been pretty much a disaster and has just not been very effective as a leader. He's promised them sanctions relief every time he's had a summit meeting, and yet he's never come back with anything significant. He's been purging lots of senior people, and when you purge lots of senior people, you're going to make all of their relatives and friends very angry at you. So he doesn't seem to have the kind of success that certainly his grandfather had. So one possibility is the senior party leaders would simply allow the Kim family members to die of COVID-19.
What should the U.S. do to prepare for something like this?
The thing in my mind that the U.S. government ought to be doing now is, one, saying we're not trying to take over the government government of North Korea. We want to see stability develop in North Korea. We're not going to attack North Korea, but in exchange, we're expecting the following. We'd like North Korea to agree to a freeze for freeze, where they freeze all production of nuclear weapons and ballistic missiles, and we freeze any kind of security challenge to them. One would think that we would be doing public information operations to give whoever comes to the position of power, even if it's Kim Jong-un, a way of saying, yeah, I selected that and I was very successful. I got the Americans to compromise and we got a better security situation.
Is it possible that if the Kim family were to be gone, that this secretive totalitarian government could change into something that is more engaged in with the world?
Most of the senior elites in North Korea, including their families, are associated with markets. You know, most of them have realized that, well, it's nice to get things from the leader. If you make yourself wealthy, you gain a degree of independent power. And the leader can still throw you in prison or send you off for re-education. But to take care of yourself and your family, being in the market, making money, that's really ideal for the leadership. If there is a replacement to the Kim family, that person is likely to come with that philosophy. That's not a democratic philosophy, but it is more a Chinese socialism philosophy, Chinese capitalism, that all of the rules that are banning the development of businesses and that sort of thing ought to be gradual.